And we're going to go back to Dr. David Winter now from Baylor Scott & White, who specializes in internal medicine. Thanks again for being here with us, Dr. Winter. I want to ask you, just because it seems like we haven't checked in on this in a while, but I know that it doesn't go away. How is the staff holding up right now there in the hospital and throughout the healthcare system here? We know that you all have dealt with wave after wave of this, and there's been great fatigue and maybe some morale issues as well. How would you say things are holding up right now compared to what we've seen in months past?
Yeah, I'm glad you asked that, Jason, because they are beleaguered now that they're smiling and they're doing a great job of taking care of folks. But yeah, it's been tough, particularly when you look at the folks in the hospital now. A lot of young folks with COVID in the hospital, that just breaks their heart. But they're working hard and they're doing a good job. And we do a lot of checking. We check on ourselves. We've got actually some counselors that we have available for the staff, and we have a checklist that they can check in and tell us how they're doing if they have any issues. So we're taking care of our own troops, but it's been tough. We're ready for this surge to go away.
Yeah, certainly. I think you speak for all of us with that. Dr. Winter, we've been getting some questions from people here, and I've had several people ask about the possibility of getting COVID repeatedly. And we have seen that with some people where they have actually gotten infected more than once. And so we've had people wondering, hey, if I've had, let's say, the Delta variant and the Omicron variant, can I assume that I'm, out of the woods at this point and kind of loosen things a little bit? Do we even know that at this point?
Yeah, you cannot assume that, Jason. Back with Delta, if you had Delta, you had some pretty good protection there, but with Omicron, it's different so far. You can get it a second time. We also know that if you've got Omicron, you do have some natural immunity there, and it holds for a while, but that tends to go away after typically a couple of months. So people say, I've got the Omicron variant, or I had Delta before, I don't need to get a vaccine, or I don't need to get a booster shot. That's not true. The natural immunity works well, but not for a long period of time. So yes, you can get it a second time. I'm sorry, go ahead.
I'm sorry, no, I cut you off. You can get it a second time in what?
So you should be cautious. I mean, if you've had it, you still can get it a second time, Jason.
So I want to ask you, we've heard some people who have, been through COVID. They recovered. We had someone who said they're 4 weeks out after, recovery, and still they just can't shake this shortness of breath every time they get up or do anything. That, some of their labs and everything are looking okay, looking normal. Have you heard that from a lot of people, that it takes a really long time to bounce back, that it's not necessarily what's called long COVID, it's just a matter of your body just trying to get back up to speed again after being knocked down so hard?
It does take a while for some people. We look like it's maybe 10, 20, 25% of folks may have some symptoms that linger for a period of time. We're not sure exactly what that's about, why some people get that and some don't. It does seem like the more serious illness you have, the more likely to last longer. But even folks with mild cases can have long symptoms. Another reason you just don't want to get it and get it over with. I don't believe in that with this particular illness. There are some rehab programs. We'll talk about that later in the program, but there's some rehab centers you can go to that can get you some treatment for those type of symptoms when they occur. But yeah, we are seeing some of that, Jason.
Makes a lot of sense. One last question for you real quick here. A lot of folks saying it's been 6 months since my last shot. Do I need to be looking for possibly another shot coming up? We don't really have a whole lot of guidance on that yet.
Yeah, a booster shot should be given to folks that are immunocompromised, elderly, frail, have a lot of medical comorbidities, say you have diabetes or heart failure or kidney, liver disease. Those folks we're saying should get another booster shot probably at 5 months. Now for the rest of us, we're not sure about that yet. We're still trying to figure that out. I wouldn't be surprised if we need to get one maybe once a year going forward, but for the young, healthy folks right now, there's no good guidance on that quite yet, so we'll have to stay tuned.
Yeah, we've really had to ramp up here and become knowledgeable about this on the fly as we've headed through this pandemic, but it certainly helps to have people like you, Dr. Winter. Thank you again for being with us here this afternoon.
Thank you, Jason. Good to be with you as always.